Hello and welcome. So if you're preparing for what is, let's be honest, the final hurdle of your orthopedic training, the fellowship examinations, then you've absolutely come to the right place. We're going to break down exactly what it takes to succeed and help you turn all those years of hard work into a successful outcome.
Okay, let's really get into this, because this one sentence, it basically sums up the entire philosophy of the exam. The FRCS, it's not just a test of what you can remember. Not at all. It's designed to see if you can think, act, and, communicate just like a day one consultant. It's all about applying what you know under pressure to solve those real-world clinical problems you're going to face.
So, here's how we're going to tackle this. We're just going to walk through the entire exam process step by step. We'll start with the structure, move on to the written paper, then the clinicals, the Vivas, and finally, we'll wrap it all up with a winning strategy.
All right, so first things first. Let's really get a handle on the landscape here. You've got to understand the timeline and the structure, because that's absolutely fundamental to building a solid prep plan. And believe me, this isn't a sprint. It's very much a marathon that needs to be paced just right. Now, this timeline, it seems a bit strict, but it's also quite generous in a way. You get a maximum of 7 years for the whole process. But the real key here, the main takeaway, is the structure. The exam is broken down into 2 very distinct phases, and the smart money is on spacing them out. Seriously, don't try to cram it all together. Spacing it out lets you switch gears in your preparation, from that broad theoretical knowledge for Section 1 to a much more focused clinical application for Section 2.
Okay, let's move on to Section 1, the written exam. This is really where you lay the foundation. It's all about testing the sheer breadth of your theoretical knowledge, and this forms the bedrock for everything that comes after.
And yeah, your first challenge is a big one. You're looking at 2 pretty demanding computer-based papers, and they're both on the same day. That's 240 single best answer questions all told. It's going to require not just deep knowledge, but some serious mental stamina to get through.
So, what do you do when you're stuck between 2 answers? We've all been there, right? It's the classic MCQ dilemma. You've managed to narrow it down, but 2 of the options just seem plausible. Well, don't worry, there's a really clear strategy for how to handle this exact situation.
The absolute key is to have a system. So, first things first, reread the question. Really read it. The wording is so carefully planned, and honestly, a single word can completely change the meaning. Second, you've got to trust your gut. That first instinct is often your subconscious pulling up the right info. And finally, and this is a big one, never, ever leave a question unanswered. There's no negative marking, so a good guess is always, always better than leaving it blank.
All right, so you've made it through Section 1. Now you arrive at the clinicals. And this is really the performance part of the exam, isn't it? This is where your knowledge, application, your clinical judgment, and your professional poise, well, it's all put right under the microscope.
Okay, so in the clinicals, you're going to face 2 very different kinds of cases. You've got the 15-minute intermediate cases, which are all about taking a deep dive into one single complex problem. You'll need a thorough history, a full exam, and a comprehensive management plan. But then, you've got the short cases, just 5 minutes each. These are all about rapid spot diagnosis and a really focused pathology-specific exam. You absolutely have to be able to switch gears between these 2 modes in an instant.
And this right here is your clinical mantra. Look, feel, move, special tests. Seriously, in that high-pressure exam room, this simple, structured framework is your absolute safety net. It forces you to be systematic, it makes sure you don't miss anything critical, and frankly, it just projects that air of calm competence that the examiners are really looking for.
Okay, let's talk about the Vivas. Now, the first thing to remember is this is not an interrogation. The whole point is to simulate an intelligent, professional chat, like the kind you'd have with a consultant colleague. Your ability to talk through your thought process is every bit as important as what you actually know.
So the Vivas are broken down into 4 distinct stations, and you'll spend about 30 minutes in each. You're going to rotate through adult pathology, trauma, then a combined station for pediatrics and hands, and of course the one everyone worries about, applied basic sciences. Each one is designed to test a core part of what we do.
And here is your secret weapon for one of the most common Viva questions you'll get, the surgical approach. Now look closely at that first step, the preamble. Before you even think about mentioning a scalpel, you start with safety and professionalism. In an appropriately marked, consented, and WHO checklisted patient, now this isn't just fluff. This immediately tells the examiners that you're a safe, modern surgeon. It sets the perfect tone from the get-go.
You know, that applied basic sciences station I mentioned, a lot of people dread it, but it's actually a massive opportunity to score big points. But here's the trick. Don't just recite facts about biomechanics. That's not what they want. The key is to explicitly link those basic science principles to your clinical decisions. Explain why a locking plate gives you angular stability. Explain how the scaphoid's blood supply dictates your management plan. That connection, that's where the real marks are.
All right, let's pull all of this together now and talk about a winning strategy. It really boils down to two things: preparing efficiently, and just as important, communicating with confidence.
So the orthopedic curriculum, it's huge, right? It's just massive. And it is completely impossible to be a world-leading expert on every single topic. The examiners know that. So success isn't about knowing everything about a few things, it's about knowing something about everything. You need that broad, sufficient knowledge base. That's the real challenge.
And to tackle that exact challenge, covering such a vast curriculum, a resource that many trainees find absolutely invaluable is a book called Concise Orthopedic Notes. It's literally designed for this purpose. It helps you efficiently get across that huge breadth of topics, making sure you build that solid, broad foundation you need to pass. So you've got the knowledge, but how do you present it with clarity and confidence? Well, use the SBAR framework: situation, background, assessment, recommendation. It's such a simple but incredibly powerful tool. It structures your thoughts, your case summaries, your management plans, and it demonstrates that clarity of thinking that is, frankly, the hallmark of a consultant. And that brings us to the final and maybe the most crucial point of all: confidence. Look, you have worked so hard for so many years to get to this point. The immense effort, all the late nights, the sacrifices you've made, all of that has prepared you for this. So when you walk into that exam, try to walk in not with fear, but with the quiet confidence that you've earned your place there. This is your time to shine. It's your moment to show them the competent, safe, and knowledgeable colleague you're about to become. Best of luck.